10 on Your Side is hosting a special streaming report, a coronavirus digital discussion. Every Monday at this time, we have an exclusive web-only newscast dedicated to the COVID-19. There is a lot to talk about today, from soaring case numbers to a vaccine that could be approved this week. Joining me now is Dr. Edward Oldfield, infectious diseases expert at Eastern Virginia Medical School. Hello, and thank you for joining us, Dr. Oldfield.
Thank you.
So we're talking about the soaring number of cases in Virginia, over 3,000 reported every day for the past 3 days, our highest numbers. What is that saying to you?
Well, I think we're starting to see a surge from Thanksgiving and a continuation of the surge, which started in November and has continued to go. But each day we're setting a new record for cases. We've set a record for hospitalizations, and almost 1,600 people in the hospital in Virginia with COVID, and almost 400 ICU beds have people with COVID in them. So this is a significant issue. And then you combine it with our increasing rates of positivity. So if you have a high rate of positive test, and considered red zone would be over 10%, what it means is you're not testing enough. You're missing a lot of people because so many of your tests are coming back positive. You really want to be 5% or less to make sure that you're doing adequate testing. So we're over 10% in the state of Virginia. We're over 11% in Chesapeake. We're over 10% in Virginia Beach. So really, where all of our local cities are getting into that red zone area, indicating we're not testing enough.
So it's interesting. I want you to talk about that a little more. So you say we're not testing enough, yet we've been trying to tell people don't go and get a test unless you have symptoms, because we are trying to, save the test for the people who are sick. So that kind of seems counterintuitive there. So do we want to do just mass testing of everyone, or do we want to save those tests for the people who already believe that they are sick or at least have been exposed?
Well, what we want to do is test close contacts, and that's been defined as a total of 15 minutes during a 24-hour period within 6 feet of a person who has documented COVID. And that's with or without a mask. The feeling is that people that are not healthcare workers don't really know how to wear the mask exactly appropriately. Mm-hmm. So that's with or without a mask. So those people, close contacts, we want to test. And we want to test anybody with symptoms. Okay. I mean, it would be great if we could go and expand that, but I think right now, because of issues with testing availability, really ought to focus on close contacts and people with symptoms. So
the Biden administration, a lot of people are calling on the new administration now to enact a national testing strategy, and the president-elect says that he would support that. What would that look like, and how would that help?
Well, I think what you would do is really unleash CDC and let them do what the best public health organization in the world should have been doing and being allowed to do for the last 9 months of this ongoing pandemic. And then they would really set up a nationwide testing scheme. We would also make sure that we have everything that we need for it and invoke the Defense Authorization Act to make sure that we have enough tubes that we need to transport in, swabs to take the test, the reagents to extract the viral DNA from RNA from the samples, and enough test kits to run them.
And that was a problem in the beginning. You said enough test kits to run them. The problem was getting those reacting agents that we could actually get the results from a test. Has that kind of been fixed? Would we have enough to test people if we wanted to expand this?
No, I don't think so. And I think we're now starting to see that backlog again, getting your results back. So, LabCorp, I think, is now up to 2 or 3 days. But if you really want to do contact tracing of cases, you need to get that result back quickly so you can get out and do contact tracing before they have a chance to infect other people.
Mm-hmm. So without this kind of information, I know the message is still telling people not to gather together for their holiday parties and events that we typically would do this time of year. Do you think that the governor needs to or will crack down further with more restrictions in the coming days or even week?
Well, he's gone from 215 gatherings to 25. I think he should probably go even further. Certainly bars need to be closed. Indoor settings are difficult, in particular because of the poor ventilation. And also if you have, it's just a place where you're really going to get into trouble when you've got indoors with people, and especially when there's drink or food involved, because you can't wear a mask when you're eating and drinking. So any holiday party where there's going to be food or drink, I think, is a setup for disaster.
Okay, so you think he should crack down a little bit more. We'll see what happens with him in the next coming days or so. Let's talk about what a lot of people are focused on right now as kind of the savior for all of this, which is the vaccine. And people are putting a lot of stock and a lot of hope in this after 9 months. Pfizer has got the first vaccine out. The FDA is going to look at that on Thursday. What do you think? Are we putting too much hope and stock in this vaccine to save us all?
I don't think so. In my 40 years of practicing infectious disease, this is the most exciting development I have ever seen. This is a true game changer. These are messenger RNA vaccines. They basically have the code to make the spike protein, so there's no live virus, there's no whole virus, and then once they've done their job, the body just eliminates what was in the vaccine. Both vaccines appear to be 95% effective, which is simply extraordinary. We would have gotten FDA approval with 50%. And here we are with an extraordinary 95% efficacy. And then if you look even closer, in the Moderna vaccine, there were 30 people that became severely ill with COVID. Every single one of them received a placebo. No one who received the Moderna vaccine had a severe illness. For the Pfizer vaccine, there were 10 with severe illness. Only one of those received the vaccine. The other thing that's important to understand is they really made an effort to broadly enroll people in these studies. So there were 11,000 people of color enrolled in the Moderna vaccine. The outcomes and efficacy were the same. There were 15,000 people over 65. Again, the protective efficacy was the same. So it looks like this vaccine is going to be good for people over 65, people of color, and people with comorbidities. So it's really beyond any expectation I had how good this is. The side effects are real, but pretty minimal. It's going to be like you had the flu for 12 hours to 24 hours. You might have some fatigue, maybe a low-grade fever, some muscle aches, but that'll be gone. And to me, I look at that as a positive because that's telling me the body is really utilizing this vaccine and making a strong response. So certainly I'll take the vaccine as soon as I can get it.
And that's the problem, perhaps, is as soon as I can get it, because now we're hearing that making this vaccine is a little trickier, taking a little more time than they thought, and they're now 6 to 8 weeks behind schedule. What do you know about that?
Well, that is true. It's just like with testing, we had issues with the supply chain. They're having issue with what they need to make the vaccine. So Pfizer has cut their estimate in half for what they feel they're going to have available. They are ramping it up now. I think they've overcome many of these stumbling blocks. So I think we're going to be off and running pretty soon. State of Virginia is expected to get about 72,000 doses of the Pfizer vaccine very shortly after it's hopefully approved on Thursday. And I can't see any reason why the FDA won't approve it when they meet on December the 10th.
So that was the number the governor gave us last week. So this information now about the manufacturing issues, not going to affect that number, but could affect then, would you say, what we had hoped for, which was getting everyone vaccinated hopefully by the summer?
Yeah, I think that's where it's going to be the amount of people that could have been vaccinated by the end of this year. So, the priorities Virginia has chosen are the same that the CDC and the advisory committee for immunization practices set up. So category 1A will be healthcare workers and people who live in skilled nursing facilities and nursing homes. For the state of Virginia, there are about 500,000 people that fit that top category. So it's going to take us longer to get that entire top tier vaccinated. The second tier is going to be what we call essential workers, those people that really make the country run. And then following in the third set is going to be people with high risk comorbidities like diabetes, high blood pressure, obesity, and people over 65 years of age. And that'll be the third group. And then after that, it'll be much more open to people to get vaccinated.
And we're talking about the Pfizer vaccine here, but then Moderna is next. They'll take that up next week. And there's a couple of more even vaccines that are going to be looked at after that. So when we're talking about maybe 4 of them coming online, that may speed things up? Or are you thinking that this whole issue with manufacturing is going to affect all of those drug makers as well?
Yeah, so the vaccines after these 2 messenger RNA vaccines are adenovirus vectored vaccines. So basically they have a virus, an adenovirus that they've put the genetic material in. So the adenovirus infects the cell and then exposes that genetic material and you make the immune response. But there are some issues with the vaccine. Apparently what the people that they hired, one of their contractors, inadvertently gave a half of a dose to a large number of people. And then the second dose, they realized it and gave the full dose because both of these are 2-dose vaccines. Mm-hmm. And so we don't know. The initial report with the people that got 2 full doses, it was only 62% effective. The people that got the half dose followed by the full dose, interesting, that was 90%. So we just don't know whether the vaccines coming after Pfizer and Moderna are going to be in the same level of efficacy. And you can't switch back and forth between vaccines. Once you get the first dose of Pfizer, your next dose needs to be Pfizer, and that's going to be 21 days later. If you get Moderna, then 28 days later, you'll need your second dose.
Any prediction from you at this point when we might be able to have a great deal of the population, everybody who wants to be vaccinated, vaccinated?
I'm thinking April and May will get most people vaccinated.
Okay. Well, that's not as bad as the end of the summer or another year from now. You are concerned, though, about one group in particular, and that is our Black community getting vaccinated. They are at higher risk and have seen more deaths. But also you're hearing that many of them don't want the vaccine.
Yeah, so for the state of Virginia, African Americans per 100,000 population, about 85% more likely to become infected. They're about 3 times more likely to end up being hospitalized. They're about 50% more likely to die. A lot of the issue here is that they're more likely to be essential workers, have jobs where they're in close contact with people. They can't work remotely. They may use public transportation more. There are more people in the household, multi-generations. So there are a lot of reasons for this, but they really should be at the front of the line and want to be at the front of the line. The last survey I saw is a little bit old, but only 25% of African Americans said they would definitely get the vaccine. 40% said definitely not, and about a third were kind of on the fence. We really need to shift that to, I would hope, 80 or 90% of African Americans will want to get this vaccine.
And how do you change a mindset that is that strong?
Well, the state of Virginia and the Virginia Department of Health are having a number of webinars put together with African American physicians, with the Governor Northam, with the head of VDH, Dr. Oliver, and they're really trying to get the message out there that this vaccine is highly efficacious and very safe. And so there's a big educational effort that the state of Virginia is putting on to change these perceptions. The other issue, I think, was it seemed like it was being pushed too fast with Operation Warp Speed. People are concerned that it was just going to get approved for non-scientific reasons, but that's not true. There are over 30,000 people in the Moderna vaccine trial, over 40,000 in the Pfizer vaccine trial. Those are the same numbers that you would get in any vaccine trial. So I think it's had a full scientific vetting and truly is efficacious and safe.
All right, Dr. Oldfield, thank you so much. We've run out of time, but I appreciate all of your insight and sharing your expertise with us as always. Have a great afternoon.
Thank you.
Thank you so much. And thanks to all of you for joining us. Be sure to join us online at this time every Monday for more coronavirus digital discussions. We'll have a recap of this interview today starting on WAVY.